5th of March, which is our first session for this year at the Odyssey APAC Scientific Forum. And today, we're very privileged to have Sujin from Ajo University. She's a PhD student, and she's happy to share with us more on how the OMOP CDM have actually enabled nursing research and impacting findings. So over to Sujin to run us through this work. Thanks.
Thank you. Hi everyone, my name is Sujin. I'm from the Department of Biomedical Informatics at Ajo University. My name is said in Korean, but my name is Sujin Gan. And anyway, I originally worked as a clinical nurse, and I'm currently a PhD student working on healthcare data research in this laboratory. And today I will present my work title, How OMOP CDM Enables Nursing Research, Standardizing and Operationalizing Nursing Relatives for Research. And this work is still in progress, actually, and I'm currently preparing a related presentation for Stigma, which is one of the largest international nursing research organizations conference, where this has been accepted for an oral presentation. So I would greatly appreciate any questions, feedback, or suggestions you may have after the talk. So in this presentation, I will briefly introduce the importance of nursing narratives and the challenges of using them in research, and our approach to standardizing nursing documentation using OMOP CDM. So as many of you already know here, real-world data has become increasingly important in healthcare research. Each EHR data contain a large amount of clinical information generated during routine patient care. And because this data reflects clear clinical practice, they have become a very valuable resource for medical research. However, there is one important issue we need to consider. Not all clinical meaningful information is captured in structured data. A large number of important information is recorded in free text documentation. And one of the most representative examples of this is nursing narratives. Nursing documentation contains a large amount of information that is important for understanding a patient's condition. In particular, it often captures patient-centered information because nurses continuously observe patients throughout the care process. As a result, nursing records frequently reflect up to changes in patient status and early signals before major clinical events occur. For example, nursing documentation may include behavior changes, emotional status, and or patient-reported symptoms or outcomes, or changes in activity and or breathing patterns. Many of these signals are typically captured in structured data, EHR data. And recent research also suggests that lifestyle and psychological factors are increasingly important in many clinical areas. This is particularly evident in fields such as cardiovascular disease research and or psychiatric research. For example, the picture here is from Jack, and well, like studies published in journals such as Jack have shown that social and psychological factors significantly influence health outcomes. So, however, these types of psychological and textual information are much more likely appeared in nursing documentation than in structured data. So to utilize these nursing narratives, NLP, the natural language processing, has been increasingly used. I also um, published one article using NLP by applying this into the nursing home healthcare nursing records. But well, still challenges remained. The first thing is that nursing narratives are still unstructured, and so it's hard to externally validate. And the second challenge is heterogeneity in documentation practices. For example, documentation formats differ between hospitals, templates differ between departments, and even the wording may differ between nurses. Because of this heterogeneity, it's not easy to directly analyze or reuse nursing narratives for research. However, an important point is that nursing as a discipline already has well-established standardized terminology. Examples include NANDA for nursing diagnosis, NIC for interventions, NOC for outcomes, and ICMP, developed by the International Council of Nurses. And these terminologies provide clearly defined concepts for describing nursing practice. Because of this, nursing data actually has strong potential to be standardized and integrated into research data models. So the objective of the research that I'm doing is to standardize nursing narratives for research use. More specifically, we aim to extract clinical meaningful signals from nursing documentation. These signals are often embedded in free text nursing narratives, notes which make them difficult to analyze in large-scale studies. And so our approach is to convert these narrative expressions into structured research features and represent them within the OMOP CDM framework. By doing so, nursing documentation can be integrated and into reproducible and scalable research workflows. Here's a proposed framework. To operationalize nursing narratives for research, we propose a four-step framework for standardizing nursing narratives. First, clinical relevant nursing features are defined. Second, the structure of nursing documentation is analyzed within the hospital CDW. Third, meaningful documentation elements are selected and validated. And finally, a mapping structure is designed to represent these features in OMOP CDM. So the first step is to define a feature dictionary. To do this, we reviewed existing nursing standard terminologies and studies related to nursing documentations. Based on these references, we identified clinically meaningful signals that can be extracted from nursing narratives. This process is being conducted in collaboration with the hospital, our University Hospital Nursing Department to ensure that the dictionary reflects the Korean nursing documentation environment. Based on this, we developed a nursing feature dictionary that captures clinically meaningful signals in nursing documentation. The dictionary includes patient-reported systems, observed clinical signs or infection-related indicators, and nursing monitoring behaviors. So it also incorporates documentation patterns and escalation signals such as physician notifications like report this symptom is reported to doctor, these kind of things. So through this structure, nursing narratives can be transformed into standardized feature for analysis. The second step is database inspection. In this step, we analyzed how nursing documentation is actually stored in the hospital CDW at Aja University Medical Center. Interestingly, we found that the nursing documentation structure at Aja University was relatively standardized, which helped us to identify clinically meaningful information more systematically. So in this step, we examined what types of nursing records exist and what kinds of clinical information they contain, and how usable information can be extracted from them. For example, if a nursing record contains a statement such as the patient complains of pain, then this information can be mapped to a standardized concept and represented as a structured feature such as pain level. In other words, this step focuses on identifying clinically meaningful signals from nursing documentation and transferring them into structured research variables. The data used in this study were obtained from Aja University Medical Center. I already mentioned in the previous slides, including both the hospital's clinical data warehouse. The data collection period spans from 2020 to 24. In 2024, we analyzed multiple types of nursing-related data, including nursing documentation, flow sheets, for risk assessment, and pain evaluations. So in total, the data contains approximately 600 million nursing-related concept records, providing a large-scale real-world data set for this study. Before mapping the data to OMOP CDM, we developed some several selection rules. Only clinical, one is all concept relevance. Only clinical relevant nursing records were migrated from the CDW. This included concept relevance checks, value validation, ensuring that essential metadata such as timestamps exist or available. And next is the result of this analysis of the structure of nursing documentation stored in the Aja University Hospital CDW. So in total, 600 million nursing documents were recorded, and each record includes multiple attributes such as the nursing record key, statement group, statement key, statement value, and other metadata related to patient and department information. We also examined different documentation types represented by the statement group codes. For example, ACT here represent nursing actions such as medication administration, and QUT corresponds to vital sign frequency records. And FRA is of course sound like free text documentation, and TET includes test or evaluation records such as GCS scores. And STE corresponds to status evaluation, which often contains narrative nursing notes. So these documentation types reflect how nursing observations and interventions are recorded in routine clinical practice at Aja University Hospital. However, during this analysis, we identified several analytical challenges. First was data. The data was too large, so it has some computational demands. And second, there are thousands of distinct flow sheets, item keys, and many of them are unrelated to the predefined clinical features. Therefore, careful filtering and feature selection were required before further analysis. And before migrating nursing data from the CDW to OMOP CDM or feature categories, we first evaluated whether each data element could be appropriately represented within the CDW CDM structure. We categorize elements based on their compatibility with the reference model, such as exact matches, partial matches, or conflicting elements. And this evaluation allowed us to determine which nursing data elements could be reliably migrated and how they should be represented in the CDM. And this table shows examples of nursing narrative expressions that were mapped to predefined features. So the nursing statements, for example, there were patient reports discomfort due to gas, then it was mapped to the features that were concerned. And when there was a statement like unable to go downstairs, then it was linked to the for list feature. So after this mapping process, in total 1,716 nursing narrative entries were analyzed, and 756 of them contained signals that matched the predefined feature dictionary. This corresponds to a feature detection rate of approximately 46%. The remaining entries mainly consisted of administrative or non-clinical content that did not represent the meaningful clinical signal. Its findings suggest that nursing narratives contain a substantial amount of clinical relevant information that can be systematically captured using feature dictionary approach. So the third step is CDM mapping. In this step, the extracted clinical information is mapped into the OMOP CDM structure using the feature dictionary defined earlier. So, for example, symptom-related information may be mapped to the observation domain, and vital sign-related information may be mapped to the measurement domain as having the concept IDs in the same as the systolic blood pressure or these kind of things. And in addition to mapping into existing CDM domains, we are also considering the possibility of developing nursing-specific tables in the future. This may allow us to better represent the characteristics of nursing documentation. This step is also conducted in collaboration with the nursing department of Paju University Hospital, and we continuously refine terminology alignment and mapping rules through iterative discussions. To illustrate how this mapping works in practice, I will show you guys a few examples. So first is we designed a mapping structure that links nursing feature tables to OMOP CDM. The left one is the newly developed feature table, and the right side one is node table that is already developed by the Odyssey. So like here, well, the feature node title could be linked to the node title in the node table. And well, most things could be directly linked to the previous attributes in the node table. And next, we transform raw CDW nursing records into the standardized CDM format. Like here, as you guys can see here, statement group is very various. ST, Q, T, 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 blah blah blah. But this and if it's about body temperature, then it's mapped to the temperature measurement feature, and later it can be mapped to the measurement table as a body temperature. And these things here too. Then these kind of things are all about nursing assessment. So this nursing assessment could be linked into the newly developed nursing table, having name as nursing assessment, and it could include the information about the reduction of urine output per hour, or if the patient has if the patient pains has get better or not. So this is conclusion. To summarize, we are working on standardizing and structuring nursing documentation using the OMOP CDM framework so that it can be used as research data. Currently, this focuses on data from a single institution in Korea. However, our long-term goal is to design a CDM mapping structure that can be interoperable across institutions and countries. During this work, we also observed that many parts of inpatient nursing documents are already partially structured, and this suggests that nursing documentation could potentially be integrated into CDM environments in the near future. And if nursing documentation becomes available within CDM-based research networks, we will be able to analyze not only conditions, medications, measurements, laboratory data, but also information related to social determinants of health, patient-reported symptoms or outcomes, and subtle changes in patient status. This may ultimately allow us to develop a more comprehensive understanding of patient healthcare in OMOP CDM infra. So this was my presentation, and thank you very much. Thank you very much.
Yeah. Thanks so much, Sujin. I think it's interesting to see how you've attempted the narrative problem, right, and how you are incorporating into the CDM. Maybe I'll start with the first question.
Yep.
How do you start off? Were you also looking into, say, for example, LLMs to pass some of these notes? Do you want to share a bit more about that? Yeah.
Yeah, I actually didn't prepare the features here, but doing this, it was a really hard work for me because even spaces, the same meanings are represented in very various expressions. Even like if it has spaces, then it's if it has a statement in the space in the statement, then it can be linked to the another picture with different meanings. So I thought to do this more effectively, I thought LLM is a must tool.
Okay, thanks. And which LLM variants do you try? Are they like OpenAI models, Claude,
Uh,
Gemini? Yeah,
the QN.
Quen models. Okay,
Yeah.
all right. Okay. Any other questions that you have from the audience? No questions? Okay. Maybe another question while waiting for more questions come in is you mentioned that you are trying to expand this work further.
Mhm.
How will this be enabled for more hospitals? Because you did mention that there is a challenge of generalizability, right? When you
Yeah.
scale across hospital, do you have any
Mhm.
ideas to do this more effectively to scale up when you go beyond just one hospital? Yeah.
Uh, I uh, I actually collaborated this work with hospital in research in Harvard and Columbia in USA. So maybe if I can have a chance, we can validate the CDM structure into their nursing documentation system.
Okay.
Hi, Mukesh. Hi, Sujin. Can you hear me?
Yes, I
Hey,
can hear
Song.
you.
Hey, we can hear you. Yes.
Yeah. Just on that topic, right? Last year at the APAC symposium, there was a group at
Mm,
the Seoul National University that presented a very similar work around
mm,
standardizing nursing statements.
yeah.
So I think it might be worthwhile for you guys to connect and make sure that there's no overlapping effort and maybe
Uh,
areas for potential collaboration, right? Because in
yeah.
essence, you guys are trying to achieve the same thing, but if things are being duplicate efforts, it might be a waste of time. Although that might be a very exaggerated expression, but I think it might be good to connect.
Yeah.
I don't know if you have access to the chat, but I just put a direct link to their poster in the chat for your reference.
Thank you. But and I actually saw the poster that was presented in APEC last year, but there are some differences, and the one is that I, as I remember, they in Seoul University they standardized the already nursing documentations, um not narrative records, but I focused on the inpatient records here. That could be that could include more um, expanded expressions. Like it also can include patients' complaints and if it what's reported to doctor and how many times is it reported to doctors and when RRT team came. These kind of things. So I think that's one difference, but as you suggested, yeah, that could be a great uh, effect. Yeah, time saving chance.
No, so based on what you just explained, Sujin, I think you can the Seoul National University team can potentially benefit from yours, right? Because what you're saying is they've done the standardization off of structured information, whereas you're currently doing some structure. Just you're trying to structure the free texts and
Mm,
then move that over to OMOP, right? So from a overall flow perspective, I think the SNU team may benefit from your work. So picking up on what Mukesh asked about expanding this to other institutions, maybe this is a good opportunity for you to reach out to the SNU team and see how your model I don't know if it can be called a model, but if your work can be applied within their systems as well. So just a suggestion there.
Oh, thank you. Thank you. I will, what was the name of the research? Can I?
I'll switch to Korean. 김현희 교수님이세요. 김현의 교수님.
아, 네. 김현희 교수님.
Right.
감사합니다.
네. You're welcome. Sujin just said thank you in Korean. I know probably most of you already know 감사합니다, right? For those of you who watch too much K-drama. But yeah, back to you, Mukesh.
Thanks, Song. I think yeah, exactly right. I think it's great if we can expand the SNU and validate some of this work. I think it will benefit the broader Odyssey community as well. Okay, I think it's a question from Septi. Over to Septi. Thanks.
Okay.
Lucas and Sujin.
Hi, Septi.
I share, like us, I think they also share it in the global community call last Tuesday. Tuesday night here. Paper also almost similar with the one that you're doing right now. From I think Inha University. Use the
Which university? I'm sorry.
and you. I don't know if it's the same with the poster that they share during APAC symposium. And so is it all the nursing documentation in Azure University Hospital using Hangul?
Septi, can you repeat your question?
Oh, is it the nursing documentation in Azure University Hospital? Is it all using Korean language or is a mix with English also?
You only written in Korean, but well, they are very quite standardized. So, and we have and nursing disciplines also have very well developed terminologies. So it would be not that difficult to map into the CDM, applied into the CDM structure framework.
How how we can nation into like a multi-city, a multi-country study. Like they all use Chinese for documentation, and I'm just curious, like how we can do like a standardized multi-country documentation for this OMOP nursing documentation.
Yeah, you're right. So I think that's why we still need the collaboration with global research and gather together. Yeah, and it really took a lot of time, took a very long time to discuss how to develop the feature dictionary. That was in the first step in this research. Yeah.
Septi, to your question, maybe we need to work on a LLM model, like Mukesh commented, where translations are happening from local languages into English. So we need an LLM model that can understand various nursing statements that is probably written in various acronyms, abbreviations, short forms, and then have that translated into normal English And then from there, we can go on to proceed with standardization into OMOP. But I think that's very challenging, right?
Yeah.
From a, like, I don't know, maybe for LLMs right now are advanced enough to do this. But according to what Sujin has presented, it seems the Korean aspect might be a bit difficult in terms of the performance of LLMs. But yeah, I'm not knowledgeable on this area, but to achieve what you just mentioned, maybe that could be one possible path forward.
Yeah, thanks, Song. Yeah, I agree. I think generally the bigger models, I believe, are capable enough. If you look at like models like OpenAI, GPT-5, and Gemini, they do come with very good language translation capabilities. In fact, they can be at the forefront of trying to do this conversion across multi-languages. And then downstream, then you sort of do it in the English framework, right? So that'll be interesting to see. And even do a benchmark, right? Which models can do this effectively, even if you just pick one language, right? Whether it's Korean or Chinese, how these models do in terms of this front-end language parsing from, say, Korea to English, you can do a lot of benchmarking there. That itself is a research use case. Yeah. Yeah.
I have no doubt that the LLMs right now are very good at translations. The only concern I have is, do they have the domain expertise to understand the human-written acronyms and abbreviations around these nursing or physicians' notes, right? Because I know in the clinical settings, not everybody writes in very full forms with appropriate spacings in between words and everything, right? So I think that will be the biggest challenge in terms of, or the biggest key performance indicator in determining whether a LLM is capable of successfully not only translating, but also extracting the features of human written clinical statements, whether that's from a doctor or a nurse, right?
Yeah, I agree. And I think again there are variants of LLMs. For example, MedGemma. I believe in one of our earlier sessions we did see the Korean team exploring MedGemma, which is a medical fine-tuned LLM, and equivalents of MedGemma. So they've been already trained with medical text to a certain extent, say by Google. And MedGemma is open source as well. So they could potentially handle it a bit better than the more generalistic models like ChatGPT, right? Which is like internet data primarily. Again, yeah, I think we need to do a lot of benchmarking before we can confidently say whether the LLMs are truly ready. Yeah. Thanks.
Sounds
Nicole?
like a good comparison study.
Yeah, nice study actually. Nicole, I see you are live there. Got any questions or comments to add? Yeah. You
Sorry,
might be on mute.
yeah, I joined a bit late, so I missed most of the presentation, so I'll need to watch the recording again.
Okay.
But it looks fabulous, the work you're doing. I can see that it can have a lot of applications to other sorts of clinical areas. And I was speaking recently to somebody about, other kinds of notes, nutritionist visit notes, or, some other supportive care notes. So I think there's some really good applications that could come out of this work. So I'm really excited to see it. So thank you.
Thank you.
Okay, sounds good. Any other questions about it? Still a bit of time left. All good, I guess. Yeah. Otherwise, I think, yeah, if there are no other questions, probably we can wrap up a bit early today. And yeah, again, take this opportunity to thank Sujin, for running us through your research. And we hope that we can see more of the benchmarking studies happening. That'll be exciting for the community to see as well. And otherwise, yeah, we'll tune in again in 2 weeks' time for the community call. Right? Thanks, everyone. Thank you.
Thank you.
Thank you.
Thanks,
Bye.
everyone.
Thank you.
Thank you. See you.